Welcome you all to the e-lecture series conducted by Society for Emergency Medicine India on behalf of National Board. And today I'm going to speak a different topic which you may not find in most of the textbooks. It is about the tips and tricks for smooth ER shift. So we all work in the emergency room, and how many times we feel that, I should have done this differently or something else must have been done for this patient, which is very common. So as emergency physicians, what we always go through is there is something or the other which a textbook does not teach or a senior does not make us learn. These are the things that most of the time comes only through experience. So today's talk, I am trying to share my experiences and what can help my juniors to handle the shifts more smoothly. That's what I will try to do in this next few minutes. Next slide. So when we say about emergency medicine, it is a specialty that has lots of moments of joy whenever you save a life or whenever a potential complication is prevented by our actions. We feel a lot of joy, elation. Again, we go through the downs of sadness, or we go with the emotions of the family when we lose a life in the emergency room, and there is always a fear that is there anything else that can be done for this patient, and we always live in some kind of anxiety whether we are doing this, whether we are doing everything right for this patient or not. So every shift we face is a mix of all these feelings, with the joy, fear, sadness, and anxiety all together we'll be facing most of the time. Despite all this, we thrive in resuscitation, quick thinking. We have to make decisions very, very fast, and we do that very confidently. Emergency procedures where time matters, whether we intubate the patient in the right time or not, we may lose the patient if it is not done at that moment. We coordinate the care a lot with multiple specialists across the hospital, and we switch tasks very easily, just like a blink of the eye. While caring for all walks of life, we don't differentiate our patients whether they are pediatric or geriatric, and we don't differentiate them at what time they're walking into the doors of our emergency. We are there 24/7, 365 days. So while doing all this, we are responsible for numerous decisions for multiple patients during our shifts. And many of the decisions, as I said, are very, very time sensitive. If it is not done at that moment, at that point, we may lose a life. By doing all this, we may have physical, intellectual, spiritual fatigue that sets in us either during the shift or after the shift. We may feel exhausted. It is very, very normal for most of us that the day we declare a death in the emergency room, the same mood sets in with even if after leaving the shift. Most of us go through that we are carried away by the emotions of the family, by the emotions of the people around us. So it is very natural to get that spiritual fatigue even during or after the shifts. So we go through a lot of roller coasters during our shifts. None of our consultants or physicians or hospital administrations are aware of, or they cannot understand what we usually go through. So I try to give you some tricks to navigate your ER shift smoothly, which no mentor can help you to teach. Or this is not something by teaching or putting it as a point that we learn. We have to learn it only by experience, as I already said. So emergency medicine is the most interesting 15 minutes of every specialty, whether it is cardiology, urology, orthopedics. We are there in the first 15 minutes of the patient care. We deal with anyone, anytime, anything. That's what emergency medicine is. So while doing this, there are differences that an emergency physician and other specialties go through. What is the most common difference? If you look at the other specialties, they start thinking, what does this patient have? What is the diagnosis? But when it comes to an emergency physician, what they think is, what does this patient need now? What does he need in the next 15 minutes or in the next 2 hours? Does this patient needs intubation to maintain his airway? Or does this patient need fluid resuscitation to maintain his blood pressure? Is what we think. Instead of going into the depth of what does this patient have, what is the diagnosis he is carrying, we try to save that life first and then go into the other details. That's the most important difference. So while doing this, we do this in the 4 defining factors. We do an initial evaluation. We do it by checking our ABCs and taking brief history and examination. We come to a certain diagnosis by ordering some tests, and we give some treatment to the patients in the emergency room. And the most important, disposition. We will decide whether this patient needs admission or can be discharged home, or this patient needs ICU, or this patient needs to be shifted immediately to OT. So these are the decisions that we have to take while dealing with any patient in the emergency room. And to be honest, while taking all these decisions, an emergency physician, experienced emergency physician, needs 30 to 60 seconds to decide whether this patient needs admission or not. The rest all depends upon what we do in the emergency room, how quickly we dispose the patient. So the uniqueness of emergency mindset is undifferentiated patient. Most of the time, we don't know what the patient is having. We are not aware of the diagnosis of the patient. Sometimes we may not even know what is the name of the patient as well. And while doing so, they may have lethal diagnosis. The patient may require endotracheal intubation or some surgery to be done and shifted to an emergency OT. And there are challenges where we have to decide whether the procedure we are doing will benefit the patient or it poses a risk to the patient. So this is a vicious cycle an emergency physician goes through, and it is the uniqueness of the emergency mindset as well, to care for the undifferentiated patient, dealing with the lethal diagnosis, and always weighing our decisions on the risk versus benefits. So emergency medicine mindset is something that is a wisdom. It will not be achieved by dealing with multiple trauma victims or resuscitating a septic shock patient or dealing with a crashing asthmatic. It is the tricks to approach mundane tasks of everyday shifts. Behave as you are remembered during your shifts and after your shift, and find a route by yourself and be a role model for your juniors. By doing this, you practice humility and kindness throughout your shifts and strive to be sheltered to your patient's storm. Most of the patients in the emergency room will have a lot of emotional imbalance, which needs to be addressed by ER physician itself. So the tricks for ER shift rhythm, this is what we will say. It's not about ER patient. You need to have a rhythm for your shift. And every shift will have certain things that you need to develop for yourself. And most important things I have named here, and it is not limited to this list alone, is first and foremost is decision making. You have to be very, very fast in your decision making. And how is your efficiency and volume of your ED patients depend? What are the expectations you set during your shift? How do you address your interruptions? How you come across your care plans? And what is our ED currency? And how do we execute our decisions? So this all is a cycle that we have to create a rhythm, so that every shift with time and again we repeat this, so that this becomes a culture for us, it becomes a habit for us, and we set the culture in the department. First and foremost is decision making. It is the most difficult task. Any patient walking into the emergency room, we have to decide whether the patient needs admission, what investigations are required, whether it is OP disposition, or this patient needs any procedures. This is a usual dilemma for every patient we see in the emergency room. Next. So by doing this, on an average, we take around 10,000 conscious or subconscious decisions during a shift. Do you think is it an easy task? Definitely not. Next. So let us see a case. A 35-year-old female presented to the ED with pain in the chest, and rest of the vitals are normal. There are no risk factors for a 35-year-old. Systemic examination is within normal limits, but pain is 8/10. ECG is done within 5 minutes, which is a normal protocol for our department, and it shows sinus rhythm. So what do we do next? Can we discharge her home? Can we admit her? What is the plan that we have in mind? What is the time that we have to order the next ECG? Are there any blood investigations we have to do? These are the usual things that goes through for seeing a simple case. This looks like a simple case for us in the emergency room, but the amount of decisions we take, next slide, the amount of decisions we take are huge. And this is sometimes overwhelming for an emergency resident who is just new in the department. And if they are stuck at one point, the patient gets stuck in the emergency room for hours together. So first and foremost, identify the decisions we need to take and work towards it. Every step we do in this should make us to get closer to the decisions we have made. we have made already. So for next thing, most important is, do you know when your team does less mistakes? When the ED is busy. It is a common observation that less mistakes are made by the team members when the ED volumes are high. ER with 1 or 2 patients, everybody gets relaxed. It's okay, only one patient. Let us deal with this patient later. So the most important and the bad strategy every emergency department faces is slipping into the slow mode during low volumes of patients. So how efficient you are now will dictate how you will handle the more volumes. So when you have time, create the time or save the time to address other issues of the department rather than keeping the patient in the emergency room when the ER volumes are less. So we cannot predict which patient walks into our door and what time they walk in, but we do have control of what our patients at this point of time need and how they are to be disposed. So let us be very clear and take care of that, low volume as an opportunity to create more time and more planning for our shift rather than keeping that patient with no decision making. So it is commonly observed and proved that your efficiency helps in increasing your productivity. It also helps in improving your patient safety, and your staff becomes happier, and it also preserves your sanity. Most of the time, that is one thing. If the patient is not disposed or care plan is not informed to the nurses, the staff becomes more and more miserable. They don't know what is to be done next. Then expectations. This is most important, that whenever we are on the shift, whenever we move to the shift first, we have to set the clear expectations for our team. Who is going to play which role? From that point onwards, what is expected out of each team member? We have to set the expectations very, very clearly at the start of the shift itself. And coming to nursing, right from sorting and arranging the equipment, checking up whether the drugs are available for the shift rightly or not, whether the resuscitation trolley is filled properly and the nurse need not run around. Everything has to be checked and set the expectation very clear. Then the expectations does not end there. It has to be to the patients what is expected out of the test. And if the patient requires admission, that has to be clearly told why you are asking for an admission for the patient. And same thing has to be communicated to the patient attenders as well. This is very important as you are seeing the patient and deciding the disposition. If you talk to them, 1, their confidence levels will increase. 2, they will not keep interrupting you. What is next? So avoid interruptions. There is a study that has been done that every emergency physician during the shift is disturbed every 6 minutes. Where disturbed is where emergency physician's attention is removed from what he is doing and asked to listen to something else is disturbed. Every 6 minutes, an emergency physician on shift is disturbed. And a break in task happens for emergency physician every 9 minutes. Just imagine how much amount of disturbances and break in tasks that happen to emergency physician, which takes a toll on the flow of work they are doing and also decreases their efficiency, and more mistakes can happen. So avoiding these interruptions is first and foremost thing that we have to set right in your department. Why the interruptions happen? We have not clearly told the care plan. We have not set expectations to our team members and to our patients and patient attenders. So they keep probing you what is happening. You are middle of resuscitation and somebody is coming and asking, can I give paracetamol to the next bed? Which is an interruption, and it takes away your attention, which is not good while you are in resuscitation. Most common, and I might have experienced it many number of times, and which made me to learn that interruptions has to be minimized when we are doing the most important task in the department, care plan. This is most important and time saving. Many a times I have seen my residents who fail to write care plans. 1, they are not confident, or 2, they are not aware how to write the care plans. Care plan consists of what investigations, what is the patient having, or what clear differential diagnosis, what does this patient need, what tests to be ordered, what basic medications to be given, and what is the disposition. So most of the time our case sheets used to be filled with the examination part and history part. The rest they leave it off because they are not confident of writing it. This delays the disposition of the patient. And also the confidence levels of the patient also comes down. The first person going to talk to the patient, you have very, very less time to gain the confidence of the patient. And if you don't come explain them what is to be done next, this is where lot of people fail. Then most of the time, whatever we have written on the case sheets or in the electronic medical records is not communicated verbally to the nursing team. Again, that becomes a challenge that nursing team is not aware of what is done. So avoiding care plans will delay your dispositions and decreases your efficiency in the shifts. Then ED currency. Most of us think that time is brain, but the most important thing for ED physicians is time. So we have to be mindful in saving the time. For every patient we see, we have to save at least 10 to 15 minutes of our time to do other tasks. And creating time again is very, very crucial. And to have a successful shift, we need to create time. How we can create time? By doing only things that are valuable. What are the valuable things? If you are spending time for decision making or your time is spent for communicating to the patient, nurse or consultants, that is valuable. Rest all communications or whatever you are using time in the department is waste. So those are the things. If you reduce your waste of time, you will make fast and accurate decisions and helps in creating more time in the shift. Execution. Once you have decided, once a decision is reached, execution is another thing that is most important, and we have to supervise or handhold the next execution. Let us say disposition. I have decided to admit this patient. So who will execute it? Nurse or some PRAs who will help in taking out the admission process. But if that is left out, the time delay that happens in getting the patient admitted once the patient in emergency room varies between 2 to 3 hours, which is a valuable time you are losing, or you are losing your resources taking care of a patient which needs to be disposed from the emergency room at the earliest. So execution becomes very, very important. Coming to investigations, most important, we keep writing a lot of investigations. The weakest diagnostic link is the slowest test you order. Majority of times, if the patient comes with fever, they'll write 1 or 2 investigations and see if they all come normal, then the second set will go, which makes it very, very difficult for using the resources in the emergency department, and even the time is lost. The patient is left, a patient coming to emergency room with 101 fever is stuck in the emergency room for 4 to 5 hours is a waste of resources and waste of time for both the physician and the patient, right? So we have to order what is needed to make your diagnosis. If it helps in making a diagnosis for you, order it. Avoid if they don't help in diagnosis, and also avoid tests in sequential order. First I will do CBC, then I will do complete urine examination is a very, very bad idea to do, and it will waste a lot of your decisions. 90% of time, the decision to admit or not to admit does not depend on any of the test results. Out of experience, we are very clear that most of the time we don't need a test result to decide whether the patient requires admission or not. So why do we waste time in admitting the patient, and why do we wait for the test result to shift the patient to the room? It's again wasting our resources in the emergency department, and again strains us both physically and mentally, keeping the patient in the emergency room and handling other patients. So these are the small tricks I have told, which may be helpful. Coming to the tips, what are the tips we can have to have a smooth ER shifts? So these are not related to patient care, but overall to the department and to the self. Next. So innovations favor not only a creative mind, but starved mind. Only when we are starved, we can come up with a lot of innovations. So few of the innovations are tips that will help us to have a smooth ER shift. Touch it once. This is the most important tip. Task most efficiently completed when it is done in one go, whether it is your patient care or anything in life. So you cannot keep going in and out of a patient chamber to decide whether the patient requires investigations or to decide whether the patient requires any further treatment. So once you have gone inside to see the patient, you have to come up with a complete plan so that your time is saved and created. As you evaluate, create a care plan so that you don't have to make multiple visits to the patient. This is the first and foremost tip For every shift, we have to remember this, that once you are seeing a patient, you are seeing it for once and you are done with that. Next, collaborate. So collaborate with your team members, with nurses and other operational team, so that you create win-win situation and you engage everybody in your work so that the work goes smooth around you. Next, communication. Most important, today's conflict should not be a barrier for tomorrow's communication. Lot of times we may end up with conflicts either with our consultants or with our nursing team or with our own team members. But working in emergency medicine, today's conflict should not be a barrier for tomorrow's communication. Today's misunderstanding should not stop us from communicating what is required on the shift for the next day. This should be the ER mindset for a successful career throughout your life. Next, harness the power of triage. So as emergency physicians, we are very good at triaging our patients depending upon their medical needs. That should not be limited only to emergency room. To organize your tasks, which is most important, which is not important, you have to prioritize them. And always love what you are doing and be uber productive at work. And remember, your brain is like a smartphone. The more number of apps that are open, it slows down. Similarly, the more number of tasks which are a combination of important and unimportant tasks, your brain also slows down, which is not good for you to work in the emergency department. Then always have a workplace philosophy, Kaizen. So this is a Japanese technique which is followed mostly by Toyota and has become very popular. So it's like, it is for improvement on everyday basis. How do you achieve it? They have a very, very good value for teamwork. Every opinion of the team member is valued. And we should set a strong personal discipline and morale so that all of us work towards the same goal, have a smooth ER shift. And confidence to give suggestions, whether it is good or bad, you should be confident in giving the suggestion. And always say room for improvement. So after every resuscitation or after every shift, analyze what has happened and what can be improved for the next shift. And create work groups who not only solve your problems, but they also come up with innovative ideas so that there is an improvement on everyday shift. Next, this is the Kaizen of ED. So it is called as 5S, a part of the same philosophy. It consists of sorting, setting in order, shine, standardize, and sustain. So sort, most important, always sort your equipment and keep them handy. You should have your intubation trolley and resuscitation cart with all emergency drugs very close to your resuscitation bay, and your nurse should not be running around to get drugs or to get equipment when it is needed. Set in order, avoid unnecessary movement in the department. If you have everything in order, once you are inside the resuscitation room, your nurse does not disappear, leaving you. And always have a cleanliness of the workplace. That will always help in creating more space and makes it clean. And standardize. Always all your workflows has to be standardized in terms of, whether you are there or not, or when your resident junior most is available in the department, the care to the patient should be the same. For that, we need to create work practices. What is to be done for a chest pain case? What is to be done for a fever case? All this has to be protocolized and kept in the department so that everybody follows and there is an order for everything, and care is standardized for most of the patients. And sustain these changes for constant results, periodically review them so that you are maintaining it. So this will help in making all the ER shifts standardized and smooth. So as we are masters of undifferentiated patients under pressure, we should have expand our emotional quotient and resilience. So we should not go away or carry away by the emotions that are being thrown in the department on us, and our mood sets the departmental mood as well. As ER physicians, we make difference in relieving pain. We look for answers and all save life. It's not about glory or receiving credit for those amazing things we do, It's like, but understanding that we are someone's hope at their worst moment. This is the difference we do in every shift for every patient. My final thoughts: be in the present moment. Don't carry the burden of your home to the department and the burden of the department to the home. Access all the information related to the patient. Make right decisions in the matter of seconds. The decision making in the emergency department has to be like a blink of an eye. And it is the key for successful mindset of an emergency physician. I'm happy to take any questions.
Thank you, Dr. Sowjanya, for this wonderful presentation.